There was a time when doctors treated acne with X-rays, beaming invisible rays onto the faces of teenagers, all in the hope of clear, flawless skin. Mothers carried mercury thermometers in their purses, trusting a sliver of liquid metal to gauge a child's health. And kits that glowed with radioactive minerals weren't sold in hospitals. They were on toy shelves in the hands of children, presented as safe, educational fun. We didn't just trust these devices, we believed they were safe. We followed the experts, read the instructions, and never questioned the consequences. But science eventually caught up, and for some, the warnings came too late. In this video, we're uncovering the most shocking medical tools ever made, once legal, widely used, and later banned for putting the very lives they promised to protect at risk. And it all begins with a device that promised radiant, flawless skin, using radiation. In mid-20th century America, doctors weren't just respected, they were almost untouchable. If a physician said it was safe, people believed it. No questions, no second opinions, no Google searches, just trust. That trust extended to every device in the room. The mercury thermometer your mother slipped into her purse, a tiny column of silver measuring your fever. The X-ray machine aimed straight at a teenager's face, promising clear skin and a healthy glow. Even glowing science kits, filled with radioactive minerals, sat on store shelves, meant for curious children exploring safe science at home. It was a different world. Regulations were loose, testing was minimal, and many gadgets reached the public on faith, tradition, or clever marketing, not decades of clinical trials. Companies sold promises of health, comfort, and the thrill of modern technology, pitching their tools to hospitals, schools, and families alike. Medicine wasn't just science, it was a vision of progress. America was obsessed with innovation, and in the medical field, pushing boundaries often meant flirting with danger. Some devices were harmless, some were genuinely helpful, and some were deadly. Yet, people embraced them, they followed instructions, they trusted the promise of science. Sometimes blindly, sometimes with quiet fear lurking in the back of their minds. Looking back now, it's shocking how close we came to disaster. In this video, we uncover the most astonishing medical devices ever sold in America. Gadgets once trusted in homes and clinics, later banned for putting lives at risk. It all begins with a device that promised flawless, radiant skin using radiation. Then, let's step back in time to an era when medicine was revered without question, and the line between innovation and danger was dangerously thin. In mid-20th century America, doctors weren't just professionals, they were almost infallible. If a doctor said a device or treatment was safe, you believed it. No second opinion, no Google search, just blind trust. And that trust extended to every gadget in the room, from the thermometer resting on your tongue to the mysterious machines pointed at your face. Take acne treatment, for instance. In the 1940s and 50s, clinics promised teens radiant, clear skin, using radiation. Yes, X-rays, not some gentle cream or topical lotion. Focused beams were directed at pimples, sometimes multiple times, to blast them away. On the surface, it sounded revolutionary, futuristic, scientific, but the consequences were terrifying. Low-dose radiation on the delicate skin of young faces caused thyroid disorders, cataracts, and even skin cancer. Tens of thousands of teenagers were exposed before the dangers were fully understood. By the time the research caught up, the lawsuits and tragedies had already begun, leaving scars that went far beyond the skin. Then there were the ubiquitous mercury thermometers. Nearly every home had one, a slender glass tube, elegant in its simplicity, containing liquid mercury that could measure a fever with precision. But fragile glass meant that spills were inevitable. Elemental mercury is highly toxic, and parents or school nurses often wiped it up with bare hands or tissues, unaware that they were spreading vaporized poison. This silent danger lingered for decades, until digital thermometers became widely available. By the early 2000s, many states had banned their sale entirely. And then came DES, diethylstilbestrol, marketed from the 1940s through the 70s as a miracle drug to prevent miscarriage. It was FDA-approved and widely trusted by doctors. Millions of pregnant women took it, believing it would safeguard their babies. But instead, it caused catastrophic harm. DES didn't prevent miscarriage, and even worse, it led to severe birth defects and rare cancers in the daughters of those women. Today, these women are remembered as the DES daughters, living with consequences that ripple across generations. Dentistry, too, wasn't immune from danger. For decades, lead-based fillings and mercury amalgams were standard practice for repairing cavities. They were durable, affordable, and seemingly effective. Yet, over time, it became clear that these metals could leach into the bloodstream, potentially harming children and pregnant women. While not banned outright, their use is now heavily restricted, a testament to lessons learned the hard way. And for one of the most chilling examples, trepanation drills. The practice of drilling holes into the human skull is ancient, but in some psychiatric institutions, modified trepanation techniques persisted into the early 20th century. Purportedly used to relieve intracranial pressure or treat mental illness, these devices left patients with literal holes in their skulls and emotional trauma that lasted a lifetime. This was an era when innovation often outpaced understanding. Devices meant to heal, sometimes harmed. Treatments that promised health and progress could, in reality, endanger lives. And yet, millions trusted these tools without question, believing that science, expertise, and modernity could never fail them. Today, these medical devices are relics, reminders of a time when trust was absolute, regulation was minimal, and the consequences of experimentation were paid in human lives. But they also serve as a stark warning. Progress, no matter how promising, must always be tempered with caution. Because history shows us that even the most modern invention can carry risks that only time and scrutiny will reveal. It's easy to look back now and ask yourself, how did anyone think that was safe? But in the moment, these devices weren't dangerous. They were marvels of innovation, the cutting edge of modern medicine. America in the mid-20th century was obsessed with progress. After the war, science and technology were booming. New meant better. Modern meant trustworthy. If a doctor said something worked, that was enough. Blind faith filled waiting rooms across the country. Regulations were loose. The FDA didn't demand the rigorous testing, clinical trials, or long-term studies that we expect today. There was no internet to fact-check, no Reddit threads, no online reviews. Families relied on their doctor's advice, glossy pamphlets promising the latest breakthroughs, and late-night television ads promising miraculous cures. This culture of trust, sometimes blind, shaped generations. It allowed medicine to advance rapidly, but it also left a trail of mistakes, some permanent, some tragic. Devices that caused radiation exposure, mercury poisoning, or unforeseen birth defects were accepted as safe because the promise of modernity was seductive. Authority was rarely questioned. Curiosity was rewarded, sometimes with consequences we would now call dangerous. And yet, that very trust built the foundation of modern healthcare. It propelled scientific discovery, gave hope to countless families, and created a culture that valued innovation. Which brings up a sobering thought. What are we trusting today that might seem safe, or even miraculous, only to shock future generations? Which innovations, endorsed by experts and celebrated in the media, could leave behind consequences we haven't yet imagined? The past reminds us that progress and caution must walk hand in hand, and that sometimes the price of discovery is measured in stories we wish we didn't have to tell. Maybe you remember that heavy glass thermometer your mom kept tucked in the kitchen drawer, the one that felt fragile, almost sacred, every time she pulled it out to check a fever. Or the sharp metallic scent in the dentist's chair, as mercury fillings were packed into your molars, promising durability but hiding a silent risk. Or perhaps your grandmother swore by a treatment that, if it appeared today, would make headlines, not for its healing powers, but for how dangerously misguided it was. Yet, back then, these weren't fringe ideas. They were mainstream, trusted, FDA-approved. Doctors prescribed them, families believed in them, and for decades they shaped how we experienced medicine. That's what makes this history so striking and personal. These devices weren't abstract tools. They touched our lives, our families, our homes. Some of us still carry the consequences, reminders of a time when innovation sometimes outpaced caution. So, we want to hear from you. Did you or someone in your family ever use one of these devices? Did your parents or grandparents swear by a treatment that now sounds unbelievable? What memories come back when you think about how medicine was practiced in those days? Drop your stories in the comments. We'd love to hear them. And if this video opened your eyes to how far we've come, hit like. Subscribe for more deep dives into America's forgotten past, and share it with someone who remembers the old school doctor visits. Thanks for watching, and stay curious. The past isn't just history. It's a lesson waiting to be remembered. Because sometimes remembering the past can help us avoid repeating its mistakes.